everybody.
Hi, everyone. Thank you so much for joining us today. I am Mariana Almanza Cook. I'm Director of Business Retention and Expansion for the Woodlands Area EDP. So thank you again for taking the time out of your busy day to join us for this quick update on one of our important employment law topics we discussed a few months ago, for those of you who joined us for our virtual HR forum. Today's webinar will be recorded and we will be sharing it as a resource with all of our business partners. I'd like to begin by reintroducing our moderator from those HR forum sessions, Holly Gruey. Holly's been with the Woodlands Area EDP since 1999, and she serves as our Chief Operating Officer. In this position, she's responsible for the day-to-day operations of the organization, and that does include managing our staff, and she serves as our HR administrator. So Holly, thanks for joining me today for this webinar.
Yes, thank you, and hello to everyone. I love it when she says 1999. I'm not sure if that makes it sound really old, or if you should say 22 years, and that makes it sound really old, but it's been a long time. But as Mariana said, I'm Holly Gruey, Chief Operating Officer for the Woodlands Area EDP, and I'd like to welcome back Josh Redelman, an associate at one of our valued partners organization, Stibbs & Co. attorney. Josh will be sharing an update to his previous presentation that he made in October, if some of you were able to join us for that. It was Return to the Workplace, Preparing for OSHA's Emergency Temporary Standard Mandating Vaccines. We would like to encourage you to add any questions for Josh on this topic to the chat box, and hopefully we can answer some of those. He's going to give us a quick, brief overview, and then any questions that you have, we will definitely get to. So with that, I'm going to pass it over to Josh. Thank you so much, Josh.
Yeah, thanks, Holly. And allow me to reintroduce myself. My name is Josh Redelman. I'm an attorney at Stibbs & Co. And my focus is employment law, advising businesses, both large and small, on issues in the workplace. And so as Holly was mentioning, back in October, we talked about President Biden's emergency temporary standard and kind of what to do to prepare in the workplace. So now you can kind of throw all of that out, unless, of course, you are a hospital or some sort of a healthcare entity that accepts Medicare and Medicaid. So as everyone, I'm sure, is following the news, they saw last week the United States Supreme Court issued two rulings. One in the case called National Federation of Independent Businesses versus the Department of Labor, and the other one is Joseph R. Biden, President of the United States, versus Missouri. And then there's Becerra, who is the Secretary of the Department of Health and Human Services for the U.S. versus Louisiana. And I've received a lot of questions over the past week. It says, Josh, why are the two orders somewhat different? Why under the Medicare, Medicaid issue is that one okay, but the one under OSHA and the employers that are larger than over 100, why is that one not okay? And really what it comes down to is the charging statute, and basically the originating statute that created OSHA and gave OSHA the rulemaking power versus the power that's authorized to the Secretary of State to the Secretary of Health and Human Services, and given the powers that are given to him or her, whoever holds the office. So if you recall in October, OSHA was basically given everything that Congress can do to regulate dangers in the workplace. And it's very important that we talk about the dangers in the workplace, because what the Supreme Court focused on in the case against the DOL is, why is COVID-19 unique to the workplace, and why is the emergency temporary standard needed to address a hazard in the workplace? And so what the majority opinion, both written by Justice Gorsuch, focused on is two things. And one of those is the danger and the regulation is targeted at a hazard that exists in the workplace, but it's also a hazard that exists outside of the workplace. And so what they focused on is, in the past 2 years, and really the administration changing from the Trump administration over to the Biden administration, kind of hampered OSHA in being able to promulgate this regulation, because 2 years ago, OSHA said we don't need a regulation. But now when the Biden administration comes in, they say, well, we need the regulation to protect for hazards in the workplace. So in the majority opinion, they kind of outlined that OSHA's tasked with ensuring the occupational safety, and that what the secretary must show is that employees are exposed to a grave danger to substances or agents determined to be toxic or physically harmful, and that the emergency temporary standard is necessary to protect the employees in the workplace from those dangers. So the problem that the court focused on is that there were no distinctions based on industry or risk of exposure to COVID-19. If you guys were participated or watched the last one we talked about, I mentioned that in restaurants, hotels, other high-touch industries, there seems to be no distinction between those folks that likely are under 100, specifically mom and pop restaurants, that would not fall under this regulation, and somebody who works in an office building where they're able to put in a lot more sanitary protections to prevent COVID-19. And OSHA didn't make the distinction, and the court focused on that. Another issue that the Supreme Court focused on is that the OSHA's regulations stop an ability to promulgate rules begin and end at the work site. So the vaccine the vaccine requirement or the mandatory testing requirement does not stop and end whenever you get to the workplace. And I'll make this analogy. When you're working on construction and you're working in high rises, the laborers have to tie off, they have to wear hard hats, they can't work certain amount of hours. Those are regulations that stop and end at the workplace. The vaccine doesn't. So the hazard exists in both the outside of the workplace and inside the workplace, but the protection and which is the vaccine doesn't stop at the workplace. So that's kind of the distinction that the court made, and why they found it unlawful is because Congress had 2 years to address this. And back in 2021, there was a decision that said these types of major political decisions and sweeping economic decisions are power that is only delegated to Congress. And because it was not to make such a sweeping regulation, it was not delegated to OSHA under OSHA's authority. OSHA exceeded its constitutional and statutory authority, and therefore the Supreme Court found it to be unconstitutional. Now, you turn to that is the DOL decision. But when you turn to the Center of Medicare and Medicaid Services decision, it's much more narrow. And the reason for that gets back to the charging statute and what gave the Secretary of Health and Human Services the power to do so. So for years, the Secretary of Health and Human Services has been able, through the various entities, has been able to promulgate all rules to enforce infection prevention and control program designed to prevent the development and transmission of communicable diseases and infections. The the CMS regulation did not apply to anybody that works at home, and it only provided, and there was a medical and religious exemption. Okay, so it's very important that we focus on what is the power of the Secretary of Health and Human Resources or Services, and what is the regulation, and what is the scientific evidence. We can have our political debate on the vaccine, but what does the scientific evidence show regarding the transmissibility and the recovery of people that end up with COVID-19? So it's also important to remember that folks that are on Medicare and Medicaid are typically the more vulnerable of society. They're less wealthy, they're older, and they're more likely to be in hospitals and this type of environment. So with that line of thinking, the court said, looking at the scientific evidence that that the Secretary of Health and Human Services provided, they said, okay, because the vaccine helps people recover faster, and because the vaccine stops people from getting the virus, that is something that will reduce the amount of patients and the backlog of patients and improve patient care. So looking at that and the staffing shortages caused by COVID-19, the Supreme Court said this is within the authority of the Secretary of Health and Human Services to promulgate a rule on the vaccines because it is so narrowly tailored and targeted. So that's basically a summary, and I want to open it up to questions from the audience because everybody can kind of read the opinion and see what it says. But I think those are two important distinctions of why the Department of Labor regulation, the OSHA regulation was not upheld, and why the CMS regulation was upheld.
Great. If there's any questions anybody wants to put in the chat box, I'm happy to read those off to Josh. And while we're waiting for anybody, if you have any, quickly, can you tell me, where do the federal workers fit in? Because there's a lot of talk about major employers, healthcare, and then federal workers had certain things they had to do. Where did they fall into this?
So currently, that's right now there's a military case that's up for debate where there was a SEAL team, U.S. Navy SEALs that have sued regarding getting kicked out of the military, and that is kind of a different military justice issue, and whether the U.S. government can mandate members of the military to get vaccinated, and I don't remember the name of the case, but it's something along the lines of, if the vaccine is out of emergency approval stage and is actually approved by the FDA, then the government can force the vaccine onto the soldiers. So it'll be interesting to see how that one plays out. As far as the federal contractors, the Biden administration is kind of attacking it two ways. One, the Biden administration is saying, if you're under a federal contract, if you receive federal money through federal contracts, then we're going to put in the contract a provision that says all your people have to be vaccinated. And if you don't do that, or all your people have to be tested. And if you don't do that, well, we're not going to work with you.
Okay.
So that's just the contracting power that the Biden administration is using.
Okay, very good. I don't see any questions just yet, but I was going to ask you another one. Are there any state regulations for Texas employers that they will need to do or follow now with any of these rulings?
Sure. So a lot of my clients are very excited that the OSHA regulation got shot down. And so Governor Abbott back in December issued a kind of a stopgap mechanism that said, I'm going to issue an executive order, and that says you cannot mandate vaccines. And if you do mandate vaccines, you have to give an exception for personal conscience, religious belief, or medical reasons. The two, medical reasons and personal conscience, or medical reasons and religious belief, always existed, right? That's under Title VII and under the ADA. So those always existed. What he added was a conscientious objector status to the vaccine mandate. But here in Texas, that exists. But the problem with that executive order is it didn't create a private right of action for the employee. And it didn't really create an enforcement mechanism from the AG's office. So on December 8th, he sent out, the Texas Workforce Commission sent out a letter and that asked people and notified people, if you believe your workplace is violating Executive Order GA 40, then you need to tell the Texas Workforce Commission about it. Because with that executive order, there are fines, but we don't know. We haven't seen anybody try to enforce it yet. We haven't seen the Texas workforce fine anybody yet. So we don't really know how that's going to play out. I think it's, all hat, no cattle a little bit with how do you enforce it? How do you actually protect the employees from multi-state employers that, say in California, you have a vaccine mandate that they try to bring to Texas. You know, don't California my Texas is a big theme. And are we? So what I think, and the intent of that executive order was to say, keep your vaccine mandates in California. Here in Texas, we don't want them, and we're not going to allow you to do them. And
Right.
if you are going to do them, you have to give people an out.
Okay. And so, I mean, the employers do still have the option to implement a vaccine mandate or testing if they so choose to.
Yes, and regardless of size. So if you run a restaurant or you run a Fortune 500 company, if you want to implement a vaccine, there's no law out there that says you can't do a vaccine or test. But what the executive order says is that you must give people the option to opt out. And how an entity is going to implement the personal conscience and based on religious belief exemption, it's an HR nightmare. And really what I would say is, if somebody says, I don't want the vaccine because I don't believe in vaccines, just let it go.
Because I think I've heard some friends that worked for major employers and they had already sent like a form out. And I think it was just truly going to be, are you going to take the vaccine or are you not?
Sure.
And if not, is it for, and there's a whole host of reasons. So if you check the box, they're not really asking you, well, what is it, religious or is it conscious? They just were like, okay, you're not, thank you. And they kind of left it alone, like you said.
Right. So there's case law regarding religious exemptions, and the Pope came out and said everyone should get vaccinated. And I know that was a point of concern, point of contention. If somebody wanted to opt out of the vaccine mandate, if they worked for somebody that was an employer that had more than 100 employees, they were concerned that the employer was going to do a deep dive into their religious beliefs.
Right.
But there is case law out there that says just because the Pope or the leader of the church says one thing does not mean that is not a doctrinal determination of your own beliefs. So you have to be really careful, and it really is a case-by-case basis. If you want to implement a vaccine or test or a vaccine mandate, and you don't want to give the option to test, you need to be careful on how deep you dive into the religious exemption, because you might be violating a protected right under Title VII.
Right. Okay. Well, I don't see any other questions. We've kind of touched a little bit about that there are some private practice health care providers they do not take Medicare or Medicaid, so they do not have to follow the vaccine order in the
Right.
care providers.
Right. So that's a really important point, Holly. So the decisions, both the DOL the decision regarding OSHA and the decision regarding the CMS mandate, both of the opinions mentioned how many people are going to be impacted by the regulation. And the DOL regulation, the OSHA regulation, is going to impact approximately 82.9 million people. The CMS regulation, far less, about 10 million people. And we're seeing some small doctor's offices say, well, we don't accept Medicare and Medicaid anymore. Okay, well, now they're no longer under the regulation, because the CMS's authority is tied to the money they are giving to the provider. And if you have a small doctor's office and you don't receive CMS, you don't receive any Medicare or Medicaid, you don't see Medicare and Medicaid patients, well, they don't have the authority to regulate you anymore.
Okay.
Now, of course, I don't think that works for large hospitals or large hospital systems, because there are a large portion, both in Texas and across the country. There are a lot of people on Medicare and Medicaid, so I don't think it's practicable for large hospital systems or large urgent cares. You see standalone urgent cares popping up, short-term care facilities, nursing homes, nursing homes especially, because you're going to have a lot of people on Medicare and Medicaid. It's not really practicable from a business standpoint to say, no, we're not taking Medicare and Medicaid patients.
Right. Okay, here's a trickier one. I don't know if you can answer it, or maybe one of our hospitals would be better, but what if there's a private physician offices, but they're a part of a hospital system, like a professional building, and the hospital is mandating? What do you think about?
So is your question for a standalone entity, or is it somebody that's a credentialed and is received? Well, there's a couple different things, right, to kind of tease out of this question. One is if it's a person that is just has their own business and has permission to operate at a hospital,
Mm-hmm.
I don't think that would make them subject to the CMS regulation.
Okay.
Now, if that person has their own office that is, let's say, St. Luke's, right? St. Luke's has standalone facilities outside of the hospital. If they have some sort of relationship where they are a St. Luke's doctor and that is a St. Luke's facility, even though it's not at the St. Luke's hospital, and they are receiving Medicare and Medicaid funding, then I think they would come under that.
Okay.
But I think the distinction between whether it comes under the regulatory authority or not, and potentially this is a better question for a regulatory Medicare and Medicaid attorney, but from what I would presume about that relationship is if they just have permission to perform surgeries at the hospital, and they're not actually receiving Medicare and Medicaid funding, I think that's really where it comes down to.
Okay, very interesting. Well, I didn't see any questions pop in, so you must have done a great job of covering.
That or a bad one, we'll find out.
Thank you so much, everybody, for joining us. Josh, thank you so much for your time. And of course, we appreciate Stibbs & Co. You guys have been a longtime partner of EDP, and you're one of the ones that we actually call when we need good advice. So we definitely appreciate our relationship. And thank you so much. We're proud to host these webinars and offer opportunities for you guys to engage throughout the year. With 2022 rolling around, I'm sure Mariana is going to have some great programs coming up. We encourage you to reach out to our office if you're not a member and you would like to join. We would love to have you, but if not, we still love to support our local employers and major employers in the area by providing quality programs. So thank you so much for joining us today. We hope everybody has a great 2022, and hopefully the weather will not be too crazy tomorrow, and we'll see. It's going to snow, right?
Thank you, everyone.
All right. Thank you.
Bye-bye.
Bye.